Arthritis is a normal part of aging. And in fact, if we were to take an x-ray or an MRI of 100 people who had no symptoms of back pain or neck pain, we would quite often see that the report might look kind of scary that we would get from the radiologist, and it may even sound scary because almost everybody over the age of 30 will have some degree of degenerative changes or beginning stages of arthritis. And arthritis is a normal part of aging, and it doesn't necessarily mean that you're going to be in pain if you have arthritis. And I have this conversation very frequently with my patients because they might have went to their medical doctor or orthopedic surgeon and have been told that they have arthritis in their spine or neck and there's nothing they could do, and they're doomed, or they may need a future operation. And again, arthritis is something that happens over many years, and it's normal, associated with normal aging. So you may have been told you have a disc bulge or disc herniation or spinal stenosis, which is narrowing of the canal where the spinal cord is or where the nerve comes out. And I'm just going to go over with you what does arthritis actually look like and how we could possibly help it. So on the end here, this is technically, quote unquote, a normal young spine. And these are just bones that we call vertebrae in the spine. It could be at any level. And what we see is between each bone, there's the padding, which is the disc, which helps with shock absorption. And as we age, the disc starts to thin or degenerate a little bit. Again, that's normal. And what also happens as the disc thins, the bones approximate. So the way the body compensates with that approximation or the increased pressure between bone and bone is generating little bone spurs, or what we call osteophytes. And as we age, sometimes the osteophytes could get bigger and more pointy as the disc thins. So you see a transition from normal to thinning to what people call bone on bone. Now, most people never reach the end stage of actual bone on bone, even though that's a lot of times what they think or what they feel. A lot of times we see patients somewhere in between this level. Now, if we look from the side, what happens is as the bones narrow, the hole where the nerves come out narrow too, and that narrowing is called stenosis. Stenosis literally means narrowing. You could have any of these changes that I just talked about, the disc degeneration or the narrowing, without any pain. All of a sudden, one day you may wake up, have pain that lingers and lasts. You go to the doctor and they tell you that it's from the arthritis. Well, there may be a part of it, but there was also a good period of time in your life where you didn't have any pain, maybe 2 weeks prior, and these degenerative changes were still there. So as we talk about a lot in our office and with our patients, pain is more complex than that, and we have a few other videos that describes that process. But I just wanted to give a visual demonstration about what arthritis may look like on an X-ray or MRI, reinforce that a lot of times it is normal, and while it may be contributing somewhat to your pain, it doesn't mean you're doomed for life because you have any of these degenerative changes. So again, a lot of times pain that's been ongoing for a while is more about heightened sensitivity of the nervous system. And the good news is that with rehabilitation and chiropractic, you don't actually have to make any change to the structure to change your function and improve the quality of your life. So arthritis, in summary, is nothing to be afraid of. The symptoms can be helped and managed successfully, and despite no changes on the X-ray or MRI. So there is hope if you have arthritis, even if you have severe arthritis.